Is Sandy in the room?
Yes, she is.
Okay, so I'm going to go in and we'll start marking her. And whoa! Hiya! You told me to look pretty. What are you doing?
I brought my
Do you not
phone.
realize you're on TV?
I'm getting my adrenaline hit.
You can't look at the Eagle firefighters and get your blood pressure up.
Can I smoke?
No, and no. I am going to leave the room right now, and I'm going to come back.
This is not going to be very fun.
I'm going to leave the room right now, and I'm going to come back, and I would like you to be in your SmartLipo clothes.
Yes, dear.
Okay.
All right.
Thank you.
Okay.
Hello?
I'm so pleased to meet you, Dr. Simon.
You didn't meet me. You've been my patient for years.
She called me into it.
Into it. Okay, so what I'm going to do is I'm going to mark the areas. We've kind of talked about what areas you want done.
Yes.
And so now we're just going to solidify that, and I'm going to kind of show you what I can and can't do.
Okay.
Okay?
Sure.
All right. What we're going to do is see how your belly button has a frown? Sad.
It's sad.
Yeah.
Make it happy.
I'll make it happy. But the reason why is because you've got extra fat that's pushing down. See, if you pull that up, you don't have that distortion. Okay. So what we're going to do is we're going to take this down, and we're going to use this demarcation as our upper abdomen. This is considered a high spot because you have a little fat pocket there, and we want the ribs to actually come out, to be defined, like they used to.
Stoked.
And then this is your midline, and I do what's called the signature Simon line. I like that look that looks like you've been working out when you really haven't.
Perfect.
Okay.
Perfect.
Okay. And then, as far as the lower abdomen, we're going to come down. I'm just going to block that shot there. Okay. So your lower abdomen, you can see your big spot is just right there. Okay. The other thing I really like to do is, you know, when you were younger, those hips that stuck out. So when you wore your underwear, you kind of almost could see down.
Uh-huh.
Okay. So I need to know exactly where that hip bone is. Okay? All right.
Just tell me by August I'll be looking really good.
You'd be hot, Mama. Okay. We're also going to do your flank, Sandy, because what's going to happen is, I know this is your problem area, but when I take that off, then you're going to say, how come I have flanks?
What happened?
Yeah. So we have just found that it works better if we just do it all at the same time. The first thing we're going to do is we're going to numb up the port sites where I'm going to make just some little poke holes. Okay? So these feel typically like bee stings. Monica is getting your pulse ox and your blood pressure.
I thought she was
Hooking
I
you
thought
up
it was
to
gonna be
life
like
support?
strapped down, like, okay, this is it, girl.
No. And you brought your living will.
I did.
Oh, good.
Durable power of attorney.
Is that to me?
Mm-mm.
Oh.
No.
Oh, well, that's a bummer. All right, so all I'm doing is just like if you were going to get something sutured up, I'm just putting just little bleps of lidocaine in the incision site. Okay, so typically the way I do it, instead of using like a needle that leaves an irregular mark, we just barely use the tip of a scalpel because anyone will tell you that a clean incision feels better. Okay? So you won't feel these, they're just little blips.
I have to agree, because when you came at me with that little sharp thing you got me in your hand, I started to get worried. Like, what?
What?
And you're going to do what?
With what? Yeah, these...
I won't feel it?
You
You're
won't
right.
feel it. Okay, so what I'm going to do is just put the cannula right in, okay? And this feels kind of just creepy, honestly, I think. Some people don't feel it at all. When I had it done, I thought it felt kind of creepy. But what it does is it is and putting lidocaine, epinephrine, and sodium bicarb in underneath the dermis and allowing the skin to be separated from the underlying tissues. So not only does it make you numb, but it makes it safer.
Do you know I fainted in every health class I ever took, and so all that stuff that you're telling me is creepier than it feels.
Okay, so I'm not going to tell you anything anymore.
Don't tell me anything. Just do
Okay.
it, because it doesn't really feel that creepy.
Right now, we're just painting butterflies on your abdomen.
Here.
Yeah, it is weird. You feel like an Oompa Loompa. I'm going to make you feel like an Oompa Loompa. All right, so one of the big tricks is how you cleave. You want a beautiful round circle with just a tiny halo in the middle. Cleaving is very difficult, but it's imperative that you get it right. My Kelly is incredible at cleaving. Okay, so you know how we put the fluid in.
Yeah.
Sandy. This is all numb. Little Oompa Loompa action, but numb. Okay? And we insert the laser. And we're just right underneath the skin for right now, right here. This is what goes under the dermis and damages the collagen. And when I say damage, people say, oh, what? But damage is good. And we like to say we do the most damage, because that means we stimulate the most collagen regrowth. I spend more time in the areas that I actually have an X. Okay? I do a little under the skin like this, but I also pinch up and get a little deeper. You just have to make sure that you really can see your laser, even if it's faint. What we're doing is the way that LACI, and when I say LACI, it's
2,000 joules.
Laser Aesthetic Contouring of Idaho, but we have patients refer to their procedure as a LACI procedure, because it incorporates other things too, like the triactive and mesotherapy or whatever they need. This is pretty good, so, all right.
There you go.
Okay, so you see that little tiny poke hole?
Yeah.
Looks like just a bee sting. This cannula will fit right in there. It's going to come out, so don't be grossed out. But it's I love it. I think it's just totally cool. See it? There it goes. That was the old Sandy. So we find by isolating the fat, by actually bringing it up, see, look at how much more we get.
That is pretty cool.
Yeah, see, if we bring the fat to us, and there's another trick too I'll show you.
This is pretty cool.
It is cool.
Honestly, it is cool.
It leaves your body, it's gone. It's actually, there's a lot of toxins in fat too, so you actually feel better. Okay, so this is that line I marked for your hip.
Yeah.
So if I go above it, the hip will pop out. So a lot of what I've seen and patients that I've fixed in the past have been, the doctor just goes straight across. Boom, boom, boom. Okay? But women don't go straight across. They go in angles. And when you laser and you suck the fat out, you should suck it out in the angle that you want it to look like. Well,
Laser
numb
second.
first, laser second, suck third. And we like to say that we suck the most.
I was going to say,
We have t-shirts.